Hey everybody, we are getting ready for another Fasting Work Girl chat at our new time tonight, just because Valentine's Day is coming up. So I'm just setting up my stand and I'm gonna join. My volume's turned up. We have some people joining in. All right. Hello.
Hi.
All right. We have people joining in as we speak. I'm just putting my little phone stand up. We'll see if this works this time. I suppose I have to stand so I don't have to hold my phone the whole time. And there we go. Okay. So we are all set, and I'm just going to go ahead and give my little disclaimer before we start. Neither myself nor Dr. Barker are your personal physicians. So while we will discuss PCOS tonight, and we're going to go into more detail about what that is, I want you guys to understand that we're providing this advice for informational purposes only. So it's really a discussion. And the things that you see raised tonight, if you have a question about how that applies to your personal situation, we encourage you to take that back to your care provider so they can look at your whole picture and then give you advice. So with that said, I'm going to go ahead and introduce our guest tonight, Dr. Nichole Barker, and she joins us, and we're super excited to have her because she is a reproductive endocrinologist and infertility specialist, also shortened to REI for obvious reasons. And she is a doctor at the Seattle Reproductive Medicine Center, and she leads the Tacoma Satellite Clinic. She is originally from Ohio and completed both her residency and fellowship in REI at University Hospital's Case Medical Center in Cleveland, Ohio. Dr. Barker's clinical interests include lifestyle and nutrition and its effects on fertility. She completed a plant-based nutrition certificate at T. Colin Campbell Center for Nutrition Studies. Dr. Barker's interests stem from her own struggles with fertility, requiring IVF to conceive and battling gestational diabetes and pre-diabetes postpartum. Dr. Barker is passionate about helping others live their healthiest lives possible and to maximize fertility potential and beyond. So as you can see, especially since we on our website and on my Instagram page focus basically all about lifestyle, how great it is to have a specialist talking with us who deals with infertility, who also has an interest in lifestyle interventions. So thank you so much for taking time to talk with us tonight. For people who may not be familiar with what an REI is, do you mind just explaining what that is briefly and why someone may need an infertility specialist?
Sure. And it's a pleasure to be on. So I'm thrilled to be here. So what an REI does, essentially, if you back up, we all have to do a residency, so 4 years of OBGYN, and then a fellowship, which is 3 years. And what that is focusing on is learning about hormones and how different things of hormonal, metabolic, structural as well, how that influences somebody's reproductive potential. And so, what you choose to do with that afterwards varies. So some people, after they graduate, go into research. Sometimes people will go in and there is a portion of surgery for structural issues that go on. So sometimes they have a heavily weighted practice in surgery. For me specifically, I'm in a big private practice, and the majority of the people I see are trying to get pregnant, or at least trying to figure out hormonally how that impacts their future fertility or how to preserve their future fertility.
Okay. And so that, just for people listening, those could be some of the reasons then why you would seek out her services or someone in a similar capacity. Now, I think at the beginning, and everyone, I apologize because I'm using acronyms, but I started off saying PCOS. And so do you mind, Dr. Barker, explaining more about exactly what PCOS is?
Sure, sure. So PCOS stands for polycystic ovarian syndrome. And so it is a misnomer a little bit because sometimes people just assume that means they get ovarian cysts, and that has different connotations. So be wary of that to figure out, or ask your provider, well, are you saying I have PCOS or I have cysts? Because there's a differentiation.
Okay.
And in the community of providers, sometimes it can be a little difficult to diagnose it too, because there's many ways that you can diagnose it. There's different ways. So it affects how research has been done. It affects how studies have been set up. But so how I diagnose this, I use something called the Rotterdam criteria. So what that means is that you need kind of 2 out of the 3 clinical criteria to be deemed PCOS. And one is menstrual irregularities. And so that could be I skip periods. I don't get them every month, or I have 2 a month, or I don't get 2 and then I get, bleeding for 3 months, or I had 1 period and then I stopped. And I never had one again. So that's one criteria. The other is something called excess androgens or hyperandrogenism.
Okay.
And what that means is that in our bodies as women, we produce testosterone, just like men have estrogen. It's just at a different level. And
Right.
so, and sometimes that excess hormone could be, kind of shown out in our what we call the phenotype. So you can get extra hair growth, or male pattern baldness, or acne that could be related to higher levels of testosterone. So that could be it, or you don't even need those. And if they check your blood levels, that could also count as it as well. But most people, I would say, complain of those things. And third is actually doing an ultrasound on the ovaries. And in the ovaries, if you look at them on ultrasound, you can count little follicles in the ovary. And these little follicles are what I call wannabe eggs. And so, and what happens in a natural cycle is that if a woman every month, on average, gets about 10 to 20 of those to be available, one of them is recruited to release, and that's what ovulation is. And in women with PCOS, or who have polycystic ovaries, they have more than average of those follicles or those wannabe eggs. And so could be 40, could be 60. And what happens is those will shift what your hormones are doing in your body. So naturally you would think, well, it kind of cycles, it senses some drops and elevation of hormones. But if you are, you have too many of these follicles, it can lead to excess estrogen, and your brain doesn't necessarily know to stimulate the ovaries to ovulate. So it's not necessarily the ovary that doesn't have enough eggs. It's usually trying to promote it to actually ovulate or release one of those eggs. And so you have to meet 2 out of the 3 criteria for that. But as I say that, there is, PCOS is a syndrome. So not every person, if you open up a book or you go online and you're reading what the prototype of the PCOS woman is, not everybody's going to fit that. And so some people might not be obese, even though about 40% are. Not everybody will have, a beard. Not everybody will have menstrual irregularities. And so as clinicians, we just need to be very careful, because it doesn't really just kind of present to you in a very neat little package. There's a continuum of signs and symptoms and how you diagnose it.
Okay. And I think several things there that you said were extremely important. And I think the first thing is that with PCOS, everyone's not going to present the same. And so when you are having difficulty conceiving for whatever reason, you may meet criteria looking just at a distance that for PCOS, but you really need to make sure that is the correct diagnosis.
That's right.
And because you could get treated as having PCOS, even though you are, you may be obese, and let's say you have acne, but so that's not the reason why you're not getting pregnant. It may contribute to it, but maybe that wasn't the actual core reason. And so instead of doing X, we might do Y. So I think having a complete picture is key. Now, in terms of PCOS, though, since there is a decent amount of patients with PCOS that are either overweight or obese, how could lifestyle interventions kind of help facilitate either improving their PCOS or even possibly reversing their PCOS?
Yeah, you know, it's so hard too, because we really don't know. I always say it's kind of like the chicken and the egg. Like, is your ovary PCO and then that throws things off, or were you kind of, you know, genetically predetermined, then your ovaries turn we don't really know. We don't have a good handle on that. So we don't really know how it like kind of starts. But and we don't know, oh, did you gain a whole bunch of weight and then become PCOS, or was it because you're PCOS that you gained weight? So it's hard to tease out. It really is. But I do know that there's a lot of good studies out there supporting that, you know, just working on weight loss, improving metabolic profile can lead to a woman regaining her, you know, regular menses, regaining her ovulations as well. And so I do think that it's super important. Now, that being said, we also see in my world fertility patients who might have been struggling for years. So you always have to kind of take, you know, an individual approach and try to kind of tailor it to that patient. You really need to take into consideration her age, her reproductive plans, as well as, you know, what are the options? You know, if somebody is morbidly obese, but they're trying to get pregnant, one, is it safe to get pregnant? And we'll talk about that, I think. Two, is it that, you know, maybe just losing a little bit of weight is going to improve things? Or is it something where you have somebody who's young, who has some time to devote towards these lifestyle changes that could, you know, improve? So it's not a slam dunk like, oh, yes, everybody who's got PCOS, well, you have to do, you know, 3 to 6 months of lifestyle changes, but overall it's going to be beneficial. And the other thing that I have to stress, and I tell my patients all the time, is that even so, 3 to 6 months, even though it seems like it's an eternity for a fertility patient. Okay, so I'm not downplaying that, but clinically it's probably going to have little effect on their outcome. You know, I think that we think, oh, I turned 35, that day that I turned 35, I'm never getting pregnant, you know, or I'm 40. And that's it doesn't really happen like that. It's a lot slower of a progression. It's not just because you're in a different age bracket and success rates doesn't necessarily mean that, you know, that day you turn that, you know, it's all over. But I really think that it's important to stress, because a lot of patients are looking not for medication, not for a higher risk of multiples, which some of our medications lead to. So these are things that if we implement them, you know, fairly early on, knowing what their diagnosis is, knowing that they do want to achieve pregnancy either now or later, is going to be beneficial.
Right. And one, I'm glad that, well, two things. So you acknowledged that the 3 to 6 month time period, even though to someone just listening and not going through infertility may say, oh, it's just 3 to 6 months. I think first you acknowledge that when you are struggling with infertility, that still seems like a lifetime.
For sure.
And
it's
so, you know, it definitely is. And so the benefit, though, of being able to see someone like yourself who gets that, you know, those time constraints are there, but then also balancing that with a trial of lifestyle interventions, just because if you can improve your health prior to pregnancy, so say even if you still end up down the road needing medications or end up having to go through IVF for whichever reason, if you were able to lose 5 to 10% of your body weight, assuming you were in an overweight or obese category, that's going to decrease your risk of pregnancy complications. And so I think sometimes we focus a lot on, I just need to get pregnant, but then we don't think of what our comorbid medical conditions can then do to that pregnancy. Is it placing us then at a higher risk of miscarriage? is it placing us at getting preeclampsia and then delivering a 27-weeker or, a host of things. So while we don't expect, you're not going to, if you've already been trying for years to get pregnant, you're probably not going to realistically want to try another 2 years of lifestyle intervention. So, I mean, we get it.
Yeah.
But at the same time, even giving yourself a chance for 3 months to kind of incorporate some other practices is probably beneficial.
I totally. And I think that it's important to know that you can kind of do those simultaneously too.
That's true.
And we understand. And, the other thing is that weight itself, just BMI might not be the best. It's not perfect. You could maybe just go not so fast down on the scale, but doing some of these lifestyle changes, you might be building some muscle, you might be improving metabolically. And so those are all going to translate. So it might not be that you can, drop all this weight, but if you're incorporating these, they ultimately are going to help with, improving metabolically and hopefully translate into a healthier pregnancy. Because as you said, I always tell my patients, yes, my goal is for you to achieve your goal, which is pregnancy usually. But I want you to get there. You are my number one priority first, mom first, and then pregnancy. And so I want you to have a healthy pregnancy, not just that you're going to get pregnant because, having a complicated pregnancy after struggling for fertility is just kind of like, pouring, lemon juice in the wound. So just not fair. It's just not fair. We want to set you up for success, essentially.
Correct. And I think too, some of the point that you made that this could be done together, simultaneously. So it's you can start, walking. If you can incorporate some physical activity into your routine and continue that throughout pregnancy, that's also going to make your pregnancy an easier time for you. So there's so many little things that add up over time that you can do, but no one's saying, you have to be perfect before you start,
And, I just kind of thought of this too, is that, there's also a, higher risk of depression in women with PCOS too. And, that compounded with the fact that you are trying to have a baby and you're, wanting to, improve your lifestyle. I mean, I feel like it could be a slippery slope that why people just feel like they can't get out of that. It's like a snowball effect, right? But it actually, I feel like if we could break that cycle, it could even help with your mood, just some of these lifestyle changes. So.
Right. And then I'm going to touch more on lifestyle or ask you a few more questions. I just wanted to read Reduce Fat Mama's comment, though. She said that my husband and I tried for 2.5 years to have a baby. She lost 40 pounds and she was able to conceive. Yay. So yes, so that's one of the examples. And we say more and more about lifestyle interventions, and sometimes I feel people think that we're being like hokey or I don't know, hippies or something, and it really isn't. There are some things that we can do naturally to maximize our health status. And I think the nice thing about integrative medicine is that, like, you and I, we're both board certified physicians, right? We believe in medicine and science. I mean, that we know what literature says. We definitely know that there are indications for certain procedures and next steps. And I mean, we know that. But at the same time, we also recognize that, have we tried to maximize your own personal health in ways through nutrition and exercise, decreasing smoking, other habits, decreasing alcohol intake if you have, problems with that. And that sometimes those things that you can do for yourself that nobody else can also lead to improved outcomes. And when that doesn't happen, we're here. I mean, that's what we're here for. For sure. And I think that, and I think that it's always good to be mindful about, most of the time people coming to see me are looking for ways to take control. Right.
And fertility is a tricky thing because we're wired to think the harder you work, the time you put in, the harder you study, you're going to be able to accomplish, right? And fertility is a different game. Most of my patients, they're doing 1,000 times more than anybody else out there to get pregnant. And it's just not fair, right? So I think that it helps to kind of remind them, hey, listen, you know, there are certain things where we can take that control back. I might not be able to guarantee you're going to have a baby, okay, tomorrow, but there are certain things that we can control how much exercise we're doing. We can control what we're putting in our mouths and what we're buying and how we're treating ourselves and giving ourselves some grace. So I feel like I do talk to my patients about that because it is so important in a world of infertility feeling out of control. And as a provider, I have a little bit of control, like not much. I'm just trying to get things where they need to go, pretty much. I think that this is so important.
Right. And then to touch on, so we keep saying lifestyle, but can you touch more about what you dealt with in terms of like the plant-based nutrition course that you did and how your practice integrates that?
Yeah. You know, that was more of a personal kind of revelation for me because of what I'd been through. So I had infertility for other reasons, but I've been through IVF. So, you know, I went through one pregnancy, went pretty well. Second pregnancy, I was a little bit older. I had diabetes and I was just kind of blaming it on, you know, stress and the placenta. I gained a normal amount of weight, but I was like, really? Like, am I diabetic? But I am. Okay. And so afterwards, about 8 months after, as we know that usually after you have the baby, gestational diabetes goes away. You're at higher risk of diabetes in the future. But 8 months down the road, I was back to my pre-pregnancy weight, which was normal weight. I felt like I was pretty healthy, but I wasn't getting a lot of sleep, but I wasn't feeling well. And so I just kind of out of the blue just checked a hemoglobin A1C and found that I was pre-diabetic.
Okay.
And so it kind of frustrated and scared me because I was like, oh my gosh, like, what am I going to do? Like, I don't feel like I need to lose a ton of weight. Like, why am I pre-diabetic? So I kind of just dug into a lot of different things, different ways of, you know, managing this. And so I kind of, you know, got really interested in finding out how can I fix it for myself. And along the way, I thought that some of these things and tools that I was learning, I could definitely, you know, suggest to my patients. Now, I'm not a nutritionist. I don't have a degree in it, but I work closely with our nutritionist at our practice, and we do offer her consultations, as well as she has an integrative kind of a group for women who are looking to maybe maximize with healthy foods and even some exercise and support, because that's important. But for me, I found that eating mainly plants, whole foods, minimizing processed foods, and vigorous exercise 3 to 5 times a week, that was the only thing that really I could find that was helping me decrease my sugars, as well as, you know, increase or decrease my hemoglobin A1C to a normal range, which it did take about 6 months to 7 months to do, if I think about it. And I just continued that because I said, you know, gosh, like, I'm going to be at risk for diabetes if I don't change something now. And I don't think that, you know, we should be touting that, you know, you need to be perfect at something, because this is not easy. A lot of us were growing up and all you ate was processed foods. Like, I'm an 80s kid, you know, so I'm like, you know, you eat cereal and, you know, everything from a box and, you know, processed food. So I feel like it's really important that, you know, all of these tools, not only for your future fertility, but for your general health, are going to be helpful.
Yes. And I think when you look at trying to improve your lifestyle, your diet, your habits prior to pregnancy, the other thing we have to keep in mind is this word's technical, epigenetics, but basically we're starting to learn more how the environment that the baby is in during pregnancy can set baby up for a predisposition to certain diseases afterwards. So, I mean, we're talking about before many of our children, like when we're pregnant, before they have any choices, any decisions on how they decide to work out, you know, when they're 20, or what they decide to eat when they're 15 or 25, whatever. Yeah. We could be doing things that could be setting them up to have a higher likelihood of childhood obesity, adult obesity, cardiovascular disease. And so the thing is, if we really believe we are what we eat in terms of how our genes take that information in the form of nutrition on how to respond, well, that nutrition is crossing the placenta, right? This is why we don't recommend alcohol during pregnancy on a regular basis, right? Because it can affect the baby. Well, the thing is, though, our nutrition as a whole can affect the baby. And so we are finding out more about that. And so it's just something to be mindful when we say it's a lifestyle. It's because we don't want you just to do it for 3 months and then you become pregnant and you're like, okay, well, everything's great now. I mean, if we're continuing this for life, then this will not only help you decrease the risk of adverse pregnancy outcomes, but it's also setting up your child to, you know, potentially have a reduced risk of obesity or certain complications in the future.
For sure. No, I think I think it's key. And I do think that for at least my own patients, even the ones who don't have PCOS, can benefit from, you know, all of these things, I think we all should be working towards health. That's just my own, my own personal opinion, but.
No, I mean, I agree. And I think, you know, as we touched on, you know, you can have the lean PCOS and you can have a phenotype or appearance, and you can have the overweight or obese type. The thing is, it's that, you know, while yes, obesity and weight does play a role in many diseases, as I've talked about on different episodes and whatnot, that's not the only reason to eat healthy, is to not be obese. And so you can have other diseases going on. People can suffer from inflammatory bowel disease, autoimmune conditions, but on the outside they look like, you know, healthy,
not struggling with weight,
or thin, or struggling with weight, but they're struggling in other ways. So some people manifest disease as obesity, and other people don't. They manifest it in the form of rheumatoid conditions or inflammatory bowel or infertility or whatever. You know, there can be so many different ways. And so just learning more about nutrition. And I don't ever think you're going to err on trying to incorporate more plants into your diet, you know, and we still need to figure out the ratio of, you know, whatever, how many to this or that or that. But I mean, I think if we can decrease our processed foods at baseline and reach for more real foods, that's going to be a good start, and incorporate some daily activity into our lives. So
absolutely.
No, I think all of that is great. That was a great overview. I'm skimming through now. I know that someone had sent a question to my DM about PCOS, and they were just wondering, is it always reversible, was the question, or can you, and I guess what they're meaning, her background in the DM was that she had PCOS, or been told that she had PCOS for like 8 or 9 years. Would it be too late to try to integrate those lifestyle suggestions that we talked about?
No, not at all. I think that obviously, as we said, all of these things could benefit. Her goals might be different if she's trying to get pregnant, or maybe she's not. But I think that, you know, integrating these now, I mean, I hear of people, you know, off the topic a little bit, but who are like, you know, 90, and they're like, should I start doing this now? Why not? Why not?
True.
And so I think that it would be definitely helpful.
Okay. Okay. And that's, I think, the key there too. It's like it's never too late. And you'll hear people say that often, like the 90-year-old example you give. I feel like some people are like, well, it's too late for me now. I've been doing this for X amount of years, but it really isn't. And our body has an amazing capability to kind of regenerate, renew, and take in that new nutrition that we're giving it, and kind of perform differently. So,
Yeah. And I do
yeah.
think that with her, I mean, because I think we have to be careful about how we say reverse, because with PCOS, if we think that essentially it's probably a genetic thing, you know, yes, I think some of the symptoms and the signs can be reversed. So yeah, we might be able to correct your ovulation. Yeah, we might be able to correct your, acne. Yeah, we might be able to, help you lose weight. But I don't necessarily know if we can. You would have to maintain these things, right?
Right.
To suppress it. So it's not like you would be cured of PCOS, but you could be maybe seeing some of those symptoms that are the hallmark of the problem go away. So I just wanted to clarify it, because I didn't want people to think you could just like wipe it out.
Right.
You're going to have to continue to worry about that. Yeah.
Right. And I think how you hit it on the head, like if you were to make all these lifestyle interventions and changes, and then you saw your symptoms improve, but then you fall off the lifestyle. Right. And so you go back to doing what you did before, symptoms of disease will return. It's kind of like when we are prescribing weight loss for diabetes. Obviously, if weight was the central part of that person being diabetic, and we can see people even come off of their insulin medications with weight loss. But if then you go back to doing whatever led you to have that weight issue in the first place, as you gain that back, then you gain those symptoms of the disease back too. So I definitely think it's always, sometimes we all need motivators. So if in the short term, your motivation for trying a more plant-based lifestyle, or if you're doing low carbohydrate, if you're trying a more low carb lifestyle, whichever you think is most sustainable. If you're starting that off for fertility and then you are able to get pregnant, you still need to kind of analyze your diet and your pattern and see what is going to be healthy to support pregnancy, and then also healthy for your family in the long haul, because our kids tend to eat like we eat. Not always, but I mean,
I wish mine would more.
But you know what I mean? Like, we model for them. So, but even though since you have a conscious effort on incorporating more plants and things like that, by default, your children will probably be exposed to more fruits and vegetables than to a parent who doesn't incorporate any of that. Do you know what I mean? So even if they don't necessarily enjoy their kale right now, they will eventually.
I know.
But
I'm hopeful.
Yeah. But even if it's that they eat more berries than other kids or whatever, I just feel like the more exposure the parents have to whole foods, just by default, their children will have a higher level exposure. Doesn't mean that's all they'll eat, but the likelihood's probably higher, I would imagine.
Set by example.
Yeah. So, yes. Well, that is about our time. We usually go for about 30 minutes. I'm looking, we're over just a little bit, but I was getting questions in my DM, so I wanted to at least ask some of them.
Sure.
But tell everyone how they can follow your work and where we can find more about your posts, because you have great posts on your Instagram.
Oh,
so
thanks. Yeah.
For people who are interested in learning more about fertility topics.
Sure. So they can follow me at fertility specialist _ Dr. Barker. And you probably can find that link. You probably tagged me in your post. So it's a kind of a long handle, but if you want to follow me, and feel free to follow along. I also try to highlight some other providers that I see who are jumping on here, who are great and have some great content. And who are very passionate about educating people. So
Great, great. Well, thank you so much for
Thank
taking
you.
the time. And I think that people are going to find this really helpful. They'll be able to see it for 24 hours in the Insta stories, and then I will post the copy of this onto my website so that you guys can see it if you have future questions, and make sure to follow Dr. Barker on Instagram.
Thank you.
All right. Have a good night.
Take care, everybody.
Bye.
Bye-bye.